Hello everybody and welcome to Jeff the Pharmacist. So today I want to talk about seasonal allergies. I thought y'all might find this useful. I'm giving kind of a brief rundown of what I almost feel a little seasonal allergies coming on. I want to give a brief rundown about kind of what your options are with seasonal allergies, and I'm talking about over-the-counter options. I just want to talk about seasonal allergies kind of characterized by runny nose or congestion, itchy eyes, sneezing, and there can also be some cough from postnasal drip. So what allergy medications do is they treat symptoms. So you want to look at what are the symptoms that you're experiencing? What's really bothering you the most? Is it the itchy eyes? Is it the congestion? Is it the sneezing? So there are different drugs that are used. So probably the most commonly used products are the oral antihistamines. So the way these work is they just kind of counteract histamine, which is kind of what is occurring in the body. There's a release of histamine in response to pollen, ragweed, and different things in the air. It's your body's normal defenses kind of overreacting to things that are harmless in the environment, and you're getting all this all this crappiness is happening, and it really sucks because it's a time we should be out and enjoying nature, but unfortunately we're having to deal with these issues. So oral antihistamines, these are drugs like Benadryl, chlorpheniramine. Those are first generation antihistamines, and the second generation antihistamines are drugs like Claritin or loratidine, Allegra or fexofenadine, Clarinex or desloratidine, Zyrtec, and Xyzal. Xyzal is a fairly new product, and I did make a video about that if you're kind of specifically curious about Xyzal. So oral antihistamines are good. They help with runny nose, they help with itchy eyes and sneezing. They're not super great with congestion. If congestion is your biggest issue, I'll talk about that later. Really, I would point people in the direction of the second generation antihistamines. There's not really evidence that any of them are better than the others. My personal favorite is Allegra, and that's just because that's what works for me. But I don't think any of them are any better than the others. Second generation antihistamines are considered non-drowsy. Some people will experience drowsiness with them, but they are considered non-drowsy, or they are the non-drowsy option compared to the first generation. Benadryl is notorious for making people sleepy. It's often used to help people sleep, and so is chlorpheniramine. That's actually the active ingredient that makes people sleep in NyQuil. They put it in NyQuil mostly for that quality, that sedative quality that it has. So if you have to go out and do stuff, the best options are going to be Claritin, Allegra, Zyrtec, or Xyzal. Again, I don't really have a preference as far as, I have a personal preference, but I don't really care. Any of them are fine, really, as far as how effective they are. And the reason that they don't cause as much sedation is because they don't get in your brain and into your spinal fluid and everything, into your central nervous system, so they don't really have a sedative effect. They're some of the most well-tolerated drugs as far as drugs go. So that's kind of one of your first line options for allergic rhinitis or seasonal allergies. Now, if you are having a terrible time with runny nose, one of the best things for that is the nasal steroids. So those are your Flonase, Nasacort, Nasonex. These go up the nose, and they're usually fairly pricey. Flonase is probably the biggest one now. Veramist is out there. Nasacort, I think Rhinocort is still a prescription drug, but these help the best with runny nose. They may help a little with congestion, but they're mostly for runny nose. So if runny nose is your biggest issue, it could also have some help. It could also help a bit with sneezing. Now, if congestion is the biggest problem, you really have to look at nasal decongestants, or later I'll talk a little bit about the Netipot. So my favorite over-the-counter drug, just how many drugs out there actually have a supporting role in a hit TV series. So my favorite drug, please subscribe, my favorite drug is Sudafed, or pseudoephedrine. And pseudoephedrine is very effective at relieving congestion. It's something you have to get usually behind the pharmacy counter. Incidentally, the law doesn't state that it has to be behind a pharmacy counter, but that's usually where they will place the drug. It actually just has to be behind a counter, any counter in the store, and you have to sign for the product, attesting that you are aware of the consequences of turning pseudoephedrine into methamphetamine. And also, most of the time your ID will be taken down, and most of the time that goes into an electronic database. So you're kind of being watched to see if you're one of these people just trying to buy up a large supply of it so you can wreak havoc in New Mexico or Arizona or wherever meth is made. But it's a very effective product for congestion. It's also has a lot of side effects, which I won't go over. I did talk somewhat more about it in my Sudafed video, if you want to know more about Sudafed, but it is very effective for congestion, and really the only product that's an oral, like a tablet that you swallow. There are nasal decongestants; those go up the nose. You spray. The problem with those, and so I'll just say, pseudoephedrine comes in the brand Sudafed, or just ask for generic Sudafed, or if you want a 12-hour product, longer lasting, so you don't have to take too many pills, it's the Sudafed 12-hour or the generic Sudafed. The nasal decongestants are effective. They have less side effects. For instance, they don't affect the heart rate and blood pressure as much as Sudafed does. The downside to nasal decongestants, and those are neo-synephrine or Afrin, is that if you take them too long, you'll get something called rebound congestion. So what occurs is, you take the drug, you're spraying it up the nose and it's helping, and when you stop taking it, that congestion can come back even worse than when you had it originally. So that can be an issue with nasal decongestants. If it is something you would not want to be taking every day. You want to use it very, very sporadically and not for more than 3 days. One tip about during allergy season, I see a lot of people kind of throwing money away, and as a pharmacist I realize how much money people are spending on drugs. So a lot of people will buy Claritin D or Allegra D. It's two great products. It's Allegra and a decongestant together, but they're expensive. And what pharmacists will usually do is they'll buy a generic Allegra, and separately they'll buy pseudoephedrine, and they'll just take them together so they don't have to spend the extra money on Allegra D or Claritin D. They really stick it to you. I mean, I think a 15-count box might be $20, $30, and that's a lot. And these same people that are buying this are coming and getting life-saving medicine and paying $30 and being upset. So obviously the issues with seasonal allergies are very real, and people are willing to pay up. But if you don't have to, don't. Look at generic Sudafed and a generic second generation antihistamine like Claritin, that would be loratidine. Allegra, that would be fexofenadine, or Zyrtec. And you can usually tell because on the label it'll have in the top, I guess it would be like the top left hand corner, it would say compare the ingredients in Zyrtec. And then there would be some warning about how it's not related to, it's not supported by the makers of Zyrtec, but it would be the same active ingredient. So can you use all this stuff together? Mostly yes. I would say definitely ask the pharmacist when you do buy it, just to see if, you know, give them a rundown of what you're taking. They can ask if you have issues with blood pressure, if you have other problems. Maybe they'll ask about glaucoma, maybe they won't, but it's good to just get their opinion about it. And there's one option I didn't mention, and that is the Netipot. So the Netipot is a non-drug option. It's very effective. Unfortunately, the congestion would come back, but if you are experiencing you're extremely congested, you're very annoyed, you can try the Netipot and it would offer you some relief. Basically what it is it looks like Aladdin's lamp, and you put in there normal saline, and you pour it through one nostril and it gets all the gunk out and it comes out the other. It's pretty gross, but it is very effective. So just to wrap it up, most people that have seasonal allergies will probably take a second generation antihistamine. If the congestion is bad, and you can take it, obviously talk to your pharmacist or your doctor about taking Sudafed, but it is an option. And if you got a super bad runny nose, consider something like Flonase or Nasacort. So I hope you all found this interesting. If you did, please give me a thumbs up. Please subscribe. It's an honor to have you watching. I want to thank you guys for watching. Thanks a lot.